Haha, the last section of this chapter. Here we're going to be discussing the different infections on and around the eye. First, we're going to focus on conjunctivitis. Okay? Infection of the conjunctiva, conjunctivitis. This is relatively common. Pretty much everybody's going to get this at some point in your life. Probably going to get multiple times. Okay? What's going to cause it? Well, it just depends on, what area on or around the eye is being infected. We're going to find there's going to be different, what is your lifestyle? Are you a person that likes contact lenses? Are you a person that rubs their eyes a lot? Things like that. When you're presented in a clinical setting with a patient you think may have conjunctivitis, the symptoms you're going to see, besides the swollen, red, maybe inflamed eyelids, they're going to talk about, you're going to actually be able to see discharge from the eye, okay? The overproduction of the tears and things, which is triggered by the inflammatory response around the eye socket. If it's a bacterial infection, you're going to see, a lot of times you're going to see milky discharge, okay? This is actually the bacterial growth in the liquid, okay? Maybe a little bit of white blood cells, some white blood cells, but that's what you're going to see bacterial. Viral, it's going to be a clear, watery discharge. Patients, no matter whether it's bacterial or viral, they're going to tell about their eyes being glued shut when they wake up in the morning. That's all that discharge, whether it's bacterial, viral, drying and sealing the eyelids together. Some of the conjunctivitis cases will begin with an allergy. Okay, people get bad allergies, pollen, fungi, fungal spores, whatever. Their eyes will get red, swollen, lots of tears going on, which will lead to an inflammation, eyelids, whatnot. But it's not actually caused by a bacterial or viral infection. There may be a subsequent bacterial infection, a subsequent viral infection, but the initial inflammatory response is actually due to allergies. One of the most common conjunctivitis you're going to see in a clinical setting will be pink eye. Unfortunately, what you're also going to see is neonatal infections. We talked about normal flora a few chapters ago and discussed that the fact that neonates' initial exposure to what will become their normal flora is passage out the birth canal, through the cervix, through the vagina, and touching labia and all of that. Well, whatever mom has growing in and on around her genitals will be exposed to the baby. Nowadays, pretty common. If you're an OBGYN, MD, or an OB/PA, nurse practitioner, to get a pretty good medical history of mom-to-be. Want to get a good history to know what she has been exposed to, kind of get an idea of her current sexual history, to get an idea of what she may be exposed to between initial meeting with you as her OB and birth. Neisseria, gonorrhea, and chlamydia trachomatis. Gonorrhea and the clap. Okay, two big problems for the neonate. Okay, it's a vertical transmission. Remember, vertical, mom to baby. As the baby passes out through the vagina, gonorrhea is present, chlamydia is present, it's going to be in colonizing the baby. The gonorrhea, the chlamydia, small chances of it being a skin infection causing lesions on the skin. Really big chance that it's going to cause an infection of the eye. You look to the right there. That is an infection. Can't remember if that's gonorrhea, chlamydia of the conjunctiva. Okay, that could lead to damage of the conjunctiva, leaving the cornea open and exposed, which could lead to scarring, which could lead to impaired vision, if not outright blindness. Herpes is also an issue here. Some of the times, gonorrhea, chlamydia, a woman may have the infection and may be asymptomatic. Okay, that's very few cases are like that. Most of those are going to have some form of discharge. So mom will know, OB/GYN, when they're doing, a prenatal checkup, will notice some form of bacterial overgrowth. What they may not notice is herpes. If the herpes vesicles are quite small or non-existent. Turns out if you've had herpes, oral, genital, you don't have to have an outbreak, the sore on your mouth or your nose, or an open sore down in your genitals, to shed virus. Turns out we find out that once you have herpes, you are constantly shedding. It's just during the times that you have the vesicle, you have the open sores, you're shedding at a much, much, much higher rate than when you think it's latent. So this is why knowing moms or the moms to be medical history is quite important. So when you look at what's going on, conjunctivitis across the board, staph epidermidis, strep pyogenes, strep pneumonia, Haemophilus influenza, Moraxella, gonorrhea, Trichomonas, across the board. If it's an older patient, teenage, adult, and you're seeing conjunctivitis and it tests as gonorrhea or Trichomonas, they have this is generally through what's referred to as autoinoculation. They've touched their genitals, they've rubbed or scratched their genitals, or they've touched somebody else's genitals, and then they rubbed their face. They've wiped their eyes. So they've passed it from somebody else's genitals to their eyes that way. Contact lenses are a really big mechanical vector here, okay? People drop their contact lenses and then pick them up and put them right onto their eye. So whatever their contact lens touched on the surface of a table, the ground, the floor, whatever, has now been placed on their eye. That's not good. Oh, side note, here's an awesome story. Okay, bear with me. Just take a few minutes. There was a problem back, can't remember, late 80s, early 90s. People were getting scarification on their conjunctiva. They were getting scarring on their cornea. What was happening is nowadays pretty much everybody has disposable contact lenses. You wear them once, throw them away, or wear them for a few days, throw them away. Well, this is back when the contact lenses first came out. They weren't thin plastic, they were actually glass, and they were for long-term usage. You would wear them to the day. Overnight, you put them in solution in a warmer, which was the solution was antimicrobial, and the warmer was also supposed to add heat to kill off everything. Well, what they weren't killing off, because it was in the cleaning solution, were amoebal cysts. Acanthamoeba cysts were in the solution. So they would put it in. The warmer would just basically wake up the amoeba, and then they would put the contact lens directly on their eyes, onto the conjunctiva. The amoeba would basically start swimming across the surface of the conjunctiva, start digesting the surface of the conjunctiva, penetrating down to the cornea. And these patients would, over a few days period, would start to complain more and more about blurry vision. They couldn't quite see correctly. It was, for some of them, they ignored it long term, and they said it was like parts of their vision was like looking through frosted glass. They went to see their doctor. They looked at it under scopes, looked at, and what they noticed was scarring. Turns out the amoeba were digesting their eyeballs. So there you go. Think about that, those of you who wear contact lenses. Prevention treatment. Ciprofloxacin is great for bacterial infections. Can't remember if this is the one they do for pink eye. Pink eye has some drops they give you. You don't even have to go in to see the doctor anymore. You just call, I think I have it, or my child has pink eye. We'll call it right in for you. You go a day. Some places they say 2 days after you start the drops. You've cleared out the bacteria, the virus, and you still have the symptoms, the swollen eyes, things like that, but you're no longer considered contagious.